Sunday. The pollen is very bad here in New Jersey today. So just be mindful of this weather. The pollen counts are high. We had a bad thunderstorm, but we're surviving here in New Jersey today. God bless you. So today I'm going to continue my topic on hemophilia. We started last week, and so I'm just going to pick that up and try to finish that up today. So let me touch back on the types of hemophilia. We have hemophilia A, which is the most common type of hemophilia. It happens when you don't have enough clotting factor 8. And the CDC estimates that about 10 in 100,000 people have hemophilia A. Hemophilia B happens when you don't have enough clotting factor 9. And the CDC estimates that about 3 in 100,000 people here in the United States particularly has hemophilia B. Then we have hemophilia C. It's also known as factor 11 deficiency. This hemophilia type is very rare, affecting 1 in 100,000 people. So the causes can be congenital, acquired, or inherited. And how does hemophilia get diagnosed by our healthcare providers? The healthcare provider will start by doing a complete history and physical exam. If you have hemophilia symptoms, the provider will ask about your family's medical history. Providers may do the following tests: CBC, a PT, an activated PTT, and a specific clotting factor test, just to see your clotting factor levels. So how do healthcare providers treat hemophilia? They treat hemophilia by boosting clotting factors levels or replacing missing clotting factors. In replacement therapy, the person receives human plasma concentrates or lab-made recombinant clotting factors. In general, only people with severe hemophilia need regular replacement therapy. People with mild or moderate hemophilia who need surgery may receive replacement therapy. They may also receive antifibrinolytics, a medication that keeps blood clots from breaking down. If someone has severe hemophilia and frequent bleeding episodes, the healthcare provider may prescribe prophylactic factor infusions to prevent bleeding. So how does someone take care of themselves when they have hemophilia? People with hemophilia may need ongoing medical treatment to prevent bleeding. They may need to avoid certain activities and medications. But there are many things you can do to manage the impact hemophilia may have on the quality of life. Bumps, falls, hard knocks that other people shake off may be serious issues for people with hemophilia. They may need to avoid activities that increase their risk of being hit or falling down after being hit. Examples include playing football, hockey, rugby, participating in boxing or wrestling, riding motorcycles, riding skateboards. Participating in other sports such as soccer, basketball, and baseball may increase their risk of injuries. That person want to make sure they ask their healthcare provider what they can do, like using protective gear so you can play these sports. Activities and actions to improve quality of life. There are many things someone can do to limit the impact hemophilia may have on the quality of life. So you want to develop an exercise routine. You may worry about hurting yourself during exercise. Talk to your provider about ways to reduce your risk. Manage stress. Have good dental hygiene. Brushing, flossing, and regular visits to your dentist reduce your risk that you'll need dental treatments that may cause bleeding. Be sure your dentist knows about your medical condition, and that includes any medical condition. Aim for a weight that's healthy for you. Managing your weight may help if you're having trouble getting around because internal bleeding damage one's joints. Educate those around you. If you have a severe form of hemophilia, you may have spontaneous bleeding that's hard to control even if you're taking medication. Make sure your family knows what to do if you have spontaneous bleeding. If your child has hemophilia, make sure your care providers and school officials know what to do if your child has bleeding issues. Some complications can include deep internal bleeding, bleeding into the throat or neck, damage to joints, infection, adverse reactions to clotting factor treatment. What are treatment complications? Some people who have replacement therapy develop antibodies called inhibitors, which attack the clotting factors that control bleeding. Healthcare providers use a technique called immune tolerance induction. An ITI involves clotting factors given on a daily basis to bring down inhibitor levels. ITI may be a long-term treatment, and some people may need this treatment for months or years. So these are just photos of what some of the joints look like with people that have hemophilia when they get hurt. So what question should I ask my healthcare provider if I'm concerned? If you or your child is diagnosed with hemophilia, you may want to ask your doctor some of the following questions. What type of hemophilia do I or does the child have? What treatments do you recommend? What are treatment side effects? What can myself or the child always need treatment? Will the person need treatment always? What activities they should avoid? What medications will be needed? And what are things that one can do to manage the impact this condition may have on life? A friendly reminder. Hemophilia is rare, inherited blood disorder that changes people's lives. People with hemophilia may need medical treatment for the rest of their lives. Parents of children with hemophilia may feel anxious about protecting them from accidental injuries. They may worry about helping their children learn to live with hemophilia. At this time, healthcare providers can't cure hemophilia. They can provide treatment to prevent or reduce hemophilia symptoms. And they can make recommendations for steps people can take to limit hemophilia impact on daily life. According to the CDC, in August 2022, about 33,000 people here in the United States alone have hemophilia. Hemophilia typically affects men and people assigned male at birth. Rarely, women and people assigned female at birth may have clotting factor levels that are so low that they develop symptoms such as having very heavy periods. Support groups that are available for those that are diagnosed with hemophilia. The World Federation of Hemophilia, National Hemophilia Foundation, Unite for Bleeding Disorders, the Coalition of Hemophilia, and the Hemophilia Society. I want to give special acknowledgement to the Cleveland Clinic, the Mayo Clinic, and Very Well Health, as well as Medline Plus for the information that I provide for you today. Should you have any questions, I ask that you join us in the Zoom room immediately after service, and I'll be happy to answer those questions for you. Thank you so much, and God bless.